Okay. Good afternoon. My name is Holly Dinany, and I am with Family Partners of Morris and Sussex County. And it is my pleasure to welcome you to our weekly Lunch and Learn program on Thursday, March 11th, 2021. The sun is shining, the snow is melting, and we are all feeling a little bit optimistic, I think, with a change in the weather and vaccines coming our way. So I would like to welcome those of you who are with us for the first time and for would just give you a little housekeeping items. We are going to keep everybody on mute unless you are speaking. And we encourage you to utilize the chat function if you have a question, if you have a comment. I will be keeping an eye on that for our presenter, Jessica Large, as well as my coworker, Krista Catano. We are going to watch you because this is your lunch. Lunch and Learn, the whole concept is you're having lunch with an expert. So we want to make sure that your questions are answered, that your concerns are addressed. So if you have one or questions, please make sure that you share them with us. So we will be recording today's meeting, which we will share with you following the event. And we also have some resources that we'll be sending your way. So feel free to take notes, but don't worry about missing anything because we will make sure that you get follow-up materials as well. So today's topic, I am very excited for. It's tips for finding a therapist. And I just want everybody to know that hopefully, Family Partners is in the business of providing support to parents or caregivers who have children with challenges. And we don't know all the answers, but we really pride ourselves in helping you find resources. That's a big part of what we do is we empower caregivers, we support them, we help make connections on resources that are available in the community. And we're fortunate that we have a lot of discussions about what's working and what's not. And recently, my team has brought to our attention that there's a lot of questions surrounding how on earth do I find a therapist? Where do I begin? What are my options? So we have designed today's program specifically to answer some of those questions and to provide some tips and resources. And the good news is you're going to learn a lot. But we're not going to give you everything because it's always evolving. So I want to encourage everybody to listen today, to take notes, but to also not be shy when you have questions. If there's something that you need that you're not getting, please reach out and we will help connect you to that. So with us today is Jessica Large, who is with the Center for Evaluation and Counseling. 10 years, she says, 10 years since December, which time flies when you're having fun,
Yes,
right, Jessica?
Yes, it does.
But Jessica is the supervisor of Outpatient Services, and she is also the coordinator, I think, for the Traumatic Loss Coalition. So
Yes.
you wear many other hats, I know, but
Yes.
I also want to lift up Center for Evaluation and Counseling to being a wonderful partner with family partners, because when we need to present information, whether it's in a lunch and learn, whether it's for one of our parenting groups, whether it's brainstorming simply how to keep information available and resources available, they have been a wonderful partner in doing so, especially in the past 12 months, Jessica. So it is a pleasure to have you with us again today. So I am going to stop. I'm going to stop yapping and I'm going to turn it over to you. But I will remind you, if you have questions, please drop them in the chat because this is your lunch and we're happy to have you with us. So
yes, definitely.
Thanks, Jessica. I'm going to turn it over to you.
All right. So I am going to share my screen. Let's see. Right. How's that? Can everybody see it?
We're good.
Excellent. Okay, so thank you for that nice introduction. So part of what I do at CEC is supervising and managing our very quickly growing outpatient program. Many people know CEC as an agency who works with DCP&P and doing forensic assessments and expert witness testimony, but this is another side of CEC where we have more of like a private outpatient sector. So with that, over the past 10 years and even before that, I have worked a lot with insurance companies, helping people find providers and get claims processed and a lot of things dealing with insurance. Before CEC, I worked for a chiropractor for over 10 years where I did all their medical billing. So I've unfortunately and fortunately have lots and lots of experience calling insurance companies and trying to help kind of navigate, because sometimes that just alone can deter people from getting the help they need because it can be very daunting. So I'm excited that we're going to be talking about this and that this will all be available for everybody. So with that said, I wanted to kind of start with talking about stigma with mental health. I believe that it's an important thing to kind of start with, that there is still a really strong stigma when it comes to mental health issues and for people getting, the treatment and help they need for mental health. So, stigma by its definition is a mark of shame or discredit. And it is really one of the leading risk factors that contribute to poor mental health outcomes because, like I said, it kind of delays treatment. People don't want to engage in therapy because of that stigma. And it really could, reduce the chances that adequate care is received. So I know that, some people might be chatting, but I was just curious, where people think some of that stigma regarding mental health might come from. If anybody has any ideas of where, like where we see that, um, where we see that portrayed, mental health in more of a negative way.
I'm watching the chat. Feel free to come off mute if you have
Yeah,
something you
yeah,
want to
totally
share.
fine.
I feel like that regarding mental health. Hi, I'm Kitty. I'm from parenting, but I feel like when and my African American community, the stigma is, well, you must be really crazy if you're going to go see a therapist. So, and it just makes a person not want to seek therapy help. So that's why the culture, traditions are some reasons why we don't go. So
Absolutely. Yeah, culture and think plays a huge part in that.
Jessica, I'm also seeing in the chat, folks are saying media, movies.
Yes. Yes. Media, movies, and then even more than that, like costumes, right? Like Halloween costumes. Like how many times is there like, an insane person or psycho this or, that's another one. Yeah.
Also, I think that like historically, I think people had a negative idea towards like people with addictions, right? It's kind of like it was a choice, not a medical problem. And therefore that kind of, I think, tied up a lot of people's mindset because people think of addiction as also a mental illness, and therefore by association other forms of mental illnesses have the same thing, like it's you could have controlled it or you didn't or something. And so like, why do you need therapy?
Right. Yeah. Yeah, those are all great, great examples and still very, very relevant today. So, that's why, we're starting to see a lot more of like stigma free. Like there's, a lot of towns and agencies that are participating in that stigma free that we're, a lot of law enforcement, will support, the stigma free mentality to try to help people, where we can.
I love that you're opening with this, Jessica, because I think the more we talk about exactly what we're talking about and the more we hear from one another, what our own experiences are and what our own culture says and what our own lives tell us. I mean, I think it's the only way to demystify, right? Or to change the attitude is to talk about it. So that's,
absolutely.
Thank you for starting this way.
Yeah, absolutely. And we could definitely come back to this as we go, but I thought that a nice kind of segue is some common myths about therapy. Stigma, myths, and kind of expectations sometimes stop people from seeking therapy for themselves or their loved ones. And this kind of goes with the stigma, right? Number one is that all people who seek psychotherapy are weak, mentally ill, or crazy. Very common, to have somebody come in who doesn't really want to be there and be like, well, I don't want people to think I'm crazy. So another myth, that therapists just sit behind a desk and take notes while you lie on a couch, right? Like that's kind of like almost like a meme or something like that you would think of, like very old school, view of what therapy actually looks like. And the truth is some therapists take notes, some don't, but there's usually a reason why a therapist is positioned in a room the way that they are, where they are in relation to you. There's typically some thought that goes in behind that. And sometimes it's important to jot some things down. But most therapists or clinicians will kind of let you know if they're going to be doing that. And you'll notice throughout the presentation that I'm going to use therapist, clinician, counselor kind of interchangeably. There are some, minute differences between them, but for the most part, broadly, people usually use them interchangeably. Number 3 is that psychotherapists and clients become best friends. A myth about therapy. People sometimes think that that's going to happen because you're talking about some of your deepest things that you've told nobody else. Psychotherapy is just talk. There's a lot of value in silence in therapy, and there's some activities, mindfulness, meditation, so it can go beyond just talking. Art, there's a lot of art therapists out there and play therapy. Also, number 5, that we have all of the ready-made solutions for all of life's problems is another common myth, that we kind of hold that magic wand. Some more is that therapists blame all of your problems and clients' problems on their upbringing, on their mom, on one particular person. And we know that the way that we're brought up, of course, contributes to how we are today, but typically your therapist isn't out to blame anybody for your upbringing. But that can certainly deter people from going into therapy if this is something that they think is common for everybody. Another big one, psychotherapists can prescribe medication. We cannot. That is the job for a psychiatrist, a doctor, or a nurse. We cannot do that. Another big one is that your problems might be solved in 1 or 2 sessions. That therapy is a process, and some people give up after a couple of sessions, maybe because they're not feeling like things are going in the right direction. Number 9, that therapists feel that your personality is done and set in stone by the time you're 5 years old. That's another common myth. And again, kind of goes along with number 8, that we make you feel immediately better after every session. Is another common myth, that you're going to always walk out of the room, on cloud 9. So, does anybody have any other myths or kind of things that you've heard before?
I want to ask you with your point 8, Jessica. Isn't it
Yeah.
true that, like, if to me, I've always thought from what I've heard other people say and experienced myself, is that to me, if it's too comfortable, it might not be working, and that I think there's got to be sometimes, you're there to talk about things that might not be easy, right?
Absolutely.
That's the
Yeah.
concept. So
Sure.
I've heard. I know one of the questions we had a parent ask recently was, is it maybe time to change therapists if it's too comfortable for a child, for
Mhm.
instance, like if it's
Mhm.
more of like a social visit than a
Right.
unearthing things?
Sure. Yeah. I mean, that's definitely something that I know I will touch on again a little bit later, but sometimes, yeah, therapy, becomes kind of stagnant,
Hmm.
and there's definitely ways to go about that. And sometimes that does mean, a change in therapist, kind of mix things up a little bit. Yeah. Anybody else? Is there any other common myths that we didn't capture here that you've either heard people say or, experienced yourselves?
What about this one, Jessica? The myth that I think you can only go to a therapist if you're rich.
Oh, yeah. Yeah. That's definitely like that. It's a luxury. That's definitely a myth. There are some great resources for low cost therapy for people to be able to have access to care. And, we're going to also go into health insurance and how you can use your health insurance to find a good therapist. There's a lot of options, but that's a great one, Holly.
And folks, don't be shy. I'm watching the chat, but you feel free to pop off
Yeah.
mute if you'd like to share something. Jessica is
absolutely.
okay with this being conversational.
Yes,
Great.
not a problem. But if not, I can move on to
Okay.
our next slide. Let me know though, if anybody wants to jump in. So this list could go on and on and on for many slides. So why do people look for therapy, right? So it could be for you, it could be for your family, it could be for your child. And these are just a few really reasons why people might seek out therapy. It can be anything just stress related. It could be people are looking for parenting skills, that they're feeling stressed by parenting. Maybe it's causing some relational difficulty. Um, we can, see people for grief, specific phobias, traumatic events. There really is no set like reason like that isn't good enough to seek out therapy. If it's just personal development and wanting to improve, on your self-esteem or just your overall well-being, there is a therapist out there, and we all have some different specialties and different areas of expertise, but there are so many reasons why people can and do engage in therapy. Sometimes have come across people saying like, well, it's not really like a big enough deal, right? Like they almost feel guilty for coming in or calling because they feel like other people have bigger problems. But self-care is so important, and it doesn't matter, what brings you through the door. It's that you came through the door and made that phone call. And that, there is somebody there to help you, guide you, and support you through that. So, like I said, this is not an exhaustive list. There are so many more, kind of presenting challenges that people may come into therapy for or start the process of looking for a therapist. Sometimes it's something noticed at school, through a guidance counselor, a teacher, a coach, and the recommendation is made that way to a parent or a family. Sometimes there's employment issues and there's specific programs, related to employment that people can seek therapy through. So there really is a very wide range of reasons why people do seek out therapy. So, expectations of therapy. There are things that you can definitely expect to experience. And kind of to your point a little bit earlier, Holly, is that therapy can take work, right? Like it's really not a passive process. There are times where sometimes it might feel that way, in the beginning of therapy, especially with a child. There's a lot of rapport building, where a clinician will want to really meet with your child and get to know them, what they like, what they don't like, kind of engage, back and forth because they're coming into a stranger, So it's important to get that kind of baseline of rapport so that when the time comes to start diving a little deeper into some heavier issues, that there is a general, baseline of rapport. And that goes for adults too. Many times people get nervous before therapy, even if it's not their first session, but nervous, like, oh my goodness, like how am I going to talk to this person? How am I going to tell them everything? But we're people. We're all people. We need to connect. And, I think the first therapist might not be your therapist, right? Like if you go in and you meet somebody for the first time and it's just not there and there's just not that kind of connection or, just first instinct of like kind of getting along with somebody, it's okay to try somebody else. Sometimes you're working with a therapist for a long time and things get stagnant, and it's always, appropriate as a client to say to them, you know what, this isn't working anymore. Like, this is like your time, this is for you, this is about you. So it's okay to say, I want to try something different. Like, and if that means going to somebody else, or if that means mix it up, challenge me, or, you really are in the driver's seat of your therapy. And I think that a lot of people tend to shy away a little bit from that. And sometimes you can get stuck in just a conversational like check-in every week. Some people need that, and that's okay, but if you're feeling like, I want to do more, I'm not feeling it, no changes are happening, that's definitely a sign to either talk to the therapist or maybe mix it up and see if there's somebody else. Does that make sense? I know that that's like an awkward conversation for people to have as well.
I have a question for you, Jessica, if I can.
Yeah.
I have heard parents concerned with youth being very savvy at saying what they think the therapist
Mhm.
wants to hear, not really so much to be manipulative, because I think sometimes it's hard to really talk about what the problem really is.
Right.
So I guess what I'm asking is, I'm hoping you can tell me that you're trained in a little BS detector, and that, I think sometimes, and all of us do that, right? I mean, you don't want to say
Sure.
when somebody says, Holly, how are you? I'm good. That's my
Right.
that's my
Right.
answer. Well, when
Right.
you're with a therapist, I think it's so important that you have a trust factor, right?
Yeah, absolutely.
That there's a vulnerability is okay there. But I mean,
Right.
what can you say about that? Because I know it's hard, and especially for if someone has a child in therapy, a lot of
Yeah.
times you're not with them. So how do
Right.
you know what's happening? Like, talk a little bit about
Yes.
that
And
dynamic.
I'm glad you brought that up. Yeah, that is tough, right? That is very tricky, because when we are in the room with a child, no matter what their age is, there has to be a level of trust. And usually, the conversation to everybody is that, as I will not, as the clinician, be telling you the blow by blow, detail by detail of everything we talk about, but I'm going to let you know when there's something that I'm concerned about, if your child is at risk of harm, or if anybody else is at risk of harm. But sometimes that's really tough for parents to hear, right? Because we want to know, like, what's going on, how can I help them, are they okay? um Ultimately, I know for myself and many of my colleagues, our goal would be that if there is something going on, um, that doesn't fall into, the child is at risk of harm or in danger, that we can kind of work with that child or adolescent to get them to a place where they can communicate that to their parents. Sometimes that's bringing the parents in, um, and having a session and help kind of facilitate that communication. It's also okay as a parent to share some information with a clinician, knowing that most clinicians will listen, take that in, but also it's not going to always be a secret from the child. Like, if it's, unless it's something that a major event is happening and it's not in the best interest of the child to hear it, like if somebody had a really rough week and the parent assumes that the child's going to come in and just say, I'm good, like, we had a great week, but like maybe there was an incident that involved police the night before. It's okay for the parents to let the clinician know that. And the clinician's going to keep that in the back of their mind, and, gently guide the child if they need to, how's it going? And say, mom told me maybe yesterday things were a little rough. Vague, but open the door to let a child have that open communication with you. And again, that goes back to that rapport. Sometimes that's not something they're ready to share with you if they don't trust you yet. And, sometimes, children, adolescents, it takes a little longer to kind of build up that trust.
And I'm going to go out on a limb too, Jessica, and say that
Mhm.
sometimes it's hard for the parents to know where the boundary is. For
Yeah.
instance, it's good for
Yeah.
me to say to you, there was an incident with the police yesterday, but I
Mhm.
cannot tell you what to say, or I
Right.
can't give you questions to give me answers
Right.
to. I think it's
Exactly.
that dance is difficult for parents, and also I'm sure for the clinician. But I'm hearing you say that if there is a risk of harm,
Mhm.
that the clinician would always
Yes.
share that with the parent. But so
Yes.
we kind of have to trust
Yes.
that there's a process
Yes.
happening there, and that if there's something the child's dealing with, that the clinician will help them
Right.
bring it to us when they're ready, or if
Absolutely.
they're ready.
And yes, and that is our duty, whether it's an adult or a child. If we feel that there is a risk of harm, we need to make sure that everybody is safe in that situation. And
This is a
usually that is right up at the front, the intake, that's explained.
I just hope our listeners realize we're talking to a clinician here. If you have questions about scenarios or things, I mean, this is
Mhm.
a really important thing to understand, because I think we either fall that we're too removed, that, oh, I can't ask, and oh, I don't want to irritate, or that we want to manage it. Is she
Right.
sleeping with him? What are they doing? Like, you
Right.
can't, I
Right.
mean, there's kind of like understanding what your role is as a
Yeah.
caregiver, I think is really key, because your therapist should be your partner
Yes.
in caring for this child. And sometimes there
Mhm.
are things that can really be managed better by a third party, right, Jessica? And
Right.
that's
Yeah. Absolutely.
okay. So don't be shy
Absolutely.
with your questions. You can drop them in the
Yeah.
chat if you'd like, and I'll be sure to bring them forward. So go ahead, Jessica.
Yeah.
Thanks.
And, we kind of talked about this in the myths, right? Like, not every session are you going to leave feeling great, right? Like therapy, again, can be difficult depending on what brought you in that day. Oftentimes that you leave a session and like you've done a lot of thinking, like you've made a lot of associations, like a lot of stuff as you're kind of having a lot of those like aha moments in your session. That processing doesn't stop when you turn the doorknob and walk out the door. You know, a lot of times therapy can be tough in between, you know, and that's all the more reason why, you know, it's important to really be open and honest, because then you get to develop some coping skills, things that you can use in between sessions, to, you know, and that's also a great place to utilize support groups, right? And these community-based outlets where there is, you know, some room, some buffer in between sessions. But therapy can be tough. And depending on what you're doing, what type of therapy you're engaged in, that processing may continue in between sessions. And that it, you know, most important is that it might not be easy, but it will be worth it. You know, to take that time to take care of yourself, your loved ones, your children, you know, your partners, to put the time into therapy, it will be worth it. How about does anybody have any other expectations or surprises, you know, that they've heard about therapy? Like things like, oh, I didn't expect it, you know, to be that way, or, you know, anything like that?
I think we're good, Jessica.
You're
Great.
good? All right. So this is a common question. And this is, again, just like the other ones, not an exhaustive list. But what do all these letters mean, right? Everybody's got all these letters after their names. You know, I have like, I don't know, 4 groups of letters. So what it means is it's a indication of education and licensure and certification. So there are, you know, I'll pick mine apart. So mine is MA, which is Master of Arts. So that means that I have a master's degree. EDS, Educational Specialist degree. So that's a postmaster's degree. And if you can visualize it, and you can kind of go back on my slides and see, they start with kind of the first that you achieved and go forward. So the last set of letters will be kind of like the most like prominent or like most weighted kind of licensure or certification, if that makes sense. So then after that is LPC. I'm a licensed professional counselor. And then ACS, approved clinical supervisor. So you can see a whole variety of letters. Typically what you're looking at is if there's an L, there have some sort of license. You know, and that could be our state works in, and most do, in like increments, where so your first year of master's, you graduate with your master's degree. Then you need to accrue thousands of hours supervised to become fully licensed. So once you've taken a test, either for social work or counseling, and as well for PhDs, you'll be an associate counselor. And these are important things to know because sometimes, and we're going to get into this later, places may not have somebody fully licensed available to see you or in your insurance network. So these are still qualified providers. So a LAC is an associate counselor who is working under somebody like myself who has the ACS, which is an approved clinical supervisor, to watch their hours and to provide clinical guidance and support for them until they get the number of hours to get the full license. So there's so many letters and they can be very confusing to people. So I thought that this might be a little helpful kind of cheat sheet, you know, to kind of walk you through what on earth do all of these letters mean.
Which I'm hoping, will you be able to share your slides maybe too, Jessica, so
I
people
will.
can have this?
Yes.
And I'm
I
looking
definitely
here,
will.
let's see, someone's asking a question. Is there a specialty in gaming addiction? And what
So,
questions do I
yeah.
ask when searching for a therapist?
Okay.
That was a 2-parter. Thank you for the question.
Yes. Very good questions. So there are definitely people, like I would not say to myself that I am a gaming addiction specialist. So a lot of times people who have the LCADC or somebody who has drug and alcohol counseling in their background has a history in addiction. So there's not necessarily a set of letters that I could think of that would indicate that, but there are definitely providers out there
Mm.
who would specialize in that.
And two things I want to jump in. I kind of read
Yeah.
half of the question, Jessica, so forgive me.
Oh,
But
that's
one
okay.
thing is, I know we did have someone who spoke recently
Yes.
on gaming addiction. He was as you said, a substance abuse
Mhm.
counselor who was getting a specialty in that. So
Yep.
I want to remind everybody, we have a newly established YouTube channel so that you can go back and look at meetings that we've held before. And I know for a fact there is one on gaming and addiction
Mhm.
and when to be aware, because the rest of the question I read too quickly was, what questions do I ask when searching for a therapist for a teenaged autistic boy showing signs of gaming addiction?
Yeah.
So,
And that, so all of that is very important, even just at your first call, just saying somebody, on the autism spectrum with a gaming addiction, because that is a very specific population.
mhm.
You want somebody who has experience working with developmental delays or disabilities or children who are on the spectrum is very important to ask, because not every therapist has the skill set to work with that child.
And the good news is though, Jessica, they would tell you that, correct? Like, so the more
Yes.
information you
Yes.
provide
The
up
more you
front,
provide, the better, the more armed and ready to like get the best therapist that you
right?
can,
Okay.
is really important.
And I also want to throw in there that we recently had a speaker from Autism New Jersey. And if you haven't already checked out their website, oh my goodness, what resources they have.
Mhm.
And they have a helpline that when you call in, they are incredibly attentive and helpful into making
Yeah.
recommendations for people who are used to working with that population. So that's something to tuck in the back of your mind.
Absolutely.
Jessica, I have another question for you.
Sure.
For trauma, how
Mhm.
to know if someone is specialized in trauma-focused therapy?
Okay. So the next slide,
Good
trauma
segue.
focused CBT. Very nice. Very nice.
Beautiful.
Yeah, more letters, right? So trauma focused is something, you can be looking for somebody who says that they're certified in TFCBT, which is trauma focused cognitive behavioral therapy. It is one of the most like widely accepted um, techniques for dealing with trauma for children. So the best way to ask about that, um, a lot of it would depend on how you're going to search, and I'm going to go through some ways to how to search for a therapist. But in your insurances or on different websites, even in bios of, different agencies, if you read a little bit about them, most people will put out there if they have experience working with trauma. Um, if they are trained in EMDR, that is also very likely that they, have a strong background in working in trauma. Any of these forms of therapy would be an indicator that somebody would, have education and knowledge and the skill set to help somebody process through trauma. There are in insurances, there is usually a listing after a provider's name of all the different specialties that they have selected themselves when they submitted their application for the insurance. So they're saying, like I would say like trauma, anxiety, and it gets listed underneath their names. So there's these directories, and then you can look there to see, is it worth even calling this person? And as always, still ask.
Mm.
Mistakes get made. Sometimes an insurance makes an error, or there was a clerical error and something gets listed, but it's not really a specialty. So you definitely kind of again goes back to the more information you can provide, like before even an intake, when you're talking to a therapist, the more information you can provide, the better. And it's okay to ask questions. It's okay, to have a brief phone call to say like, what are your qualifications? What are your credentials? More and more, you're seeing a lot of websites or databases where people are putting up their bio, putting up, a picture to the name, which is comforting for a lot of people to be able to be like, oh, okay, that's who I'm going to see when I walk in the office. So definitely ask away and always ask if versed in working with people who have been traumatized.
That's great. And I have a couple more questions for you,
Sure,
Jessica, but I just
great.
want to reemphasize that it's in the therapist's best interest as well to make sure that they are equipped to
Absolutely.
help. They're not looking to get more business and
No.
loop you in. If they can't address, I think they're pretty
Yeah.
straight out. Okay. Here we
Yes.
have another question. This one has a lot going on. So I like that,
Okay.
that we're asking, because I think this is really helpful.
Mhm.
So what kind of therapist would you look for if you have cancer,
Mhm.
but you're looking for an adult perhaps, but also for a special needs child that has autism, ADHD? There's a lot going on there with the caregiver and with
Mhm.
the child. So what would you recommend as possible things in that scenario? Because those are really, support is super, super important.
Yeah, very important. So it would be somebody looking for a therapist for themselves as the adult, but who has a child with
I believe so.
the,
Yes.
okay. That's a good question. That's a lot. I would definitely want somebody who has experience or has like an expertise talking about parenting.
Mm.
Because if nothing else, they would know the resources to get more information to help you, process and parent and discipline a child with those special needs.
Mm.
And as far as the primary, as the parent having cancer, I would think about what are, the challenges that go with that. What are is it anxiety, depression, and look a little like, what does it feel like emotionally? And then see if you can find a therapist who has a specialty in that area.
Mhm. I'm going to jump in and do a little commercial too, Jessica, because
Mhm.
as I said at the beginning of this program, Jessica has been really gracious in working with us to meet some of the questions that we find with our parents. And I know Jessica connected us with a wonderful colleague of hers who's
Yeah.
going to do a presentation for us April 8th, I believe. You will be getting information about it. We have a mom support group that meets every Thursday evening. And Jessica has arranged for someone to come in specifically talking about how to parent children who are experiencing or have experienced trauma. And certainly having an adult in their life that they love who is ill is one of those things, because I
Yeah.
know we met recently to discuss, some of the things that they might cover. And for instance, disciplining that child
Yes.
becomes more difficult when there's a lot of stuff going on. So look for more information about that discussion, because I
Mhm.
think there will be more resources shared. But the more specific you can bring about your challenges, the better. And also, I don't know, Jessica, what I think of for the parent with cancer, I'm sure there are support groups as well
Absolutely.
dealing with your illness, dealing with
Yes.
treatments, dealing with worrying about yourself and others. So I hope
Yeah.
we answered part of your question. If we did not, would you please, send something in the
Yes,
chat or
please
to
let
me
us know.
privately? Because I got another one for you, Jessica. I like
Okay.
this. I like our participants providing here. I have a question. Someone's asking specifically about looking for a therapist who is, I like the way they say this, who is affirming in dealing with the LGBTQ plus scenarios instead of fixing
Yes.
LGBTQ. Like, that's a really great question. And I think, sometimes we have to be careful with someone's a professional's maybe personal opinion on things or religious opinion on things.
Yes.
So I'm looking at the question, but I mean, how would
Mhm.
you, I just want to make sure, I'm sorry, I'm having a hard time with my, how would you make sure
Right.
that you are asking the right questions when you're looking for someone who is friendly and affirming?
Right. Right.
As I'm looking here, so I realized that some did not know what this meant. If I had to explain it, I did not feel they were appropriate resource, A++.
Mhm.
Specifically, we want someone who is trained working with
Yes.
LGBTQI, using affirming language. Instead, let's see here, but rather dealing with the trauma associated with rejection and abuse. So that's a lot of things going on there. But I'm just going to hop on and say, anybody who wants to ask us, we know of several support groups and
Mhm.
social groups for those youth and their parents. So
Mhm.
I'm going to make myself a list or note to make sure to share that later. But I'm going to throw it to you,
Yeah.
Jessica.
Well, and again, so that's not going to be just any therapist, right? So any therapist who, not any therapist, most therapists can still work with, a youth or a family who is LBG, TQ, they can do that. But it depends on what the presenting issue is, right? So that doesn't, just because that's the population that they're identifying with, does not mean that that's why they're going to therapy, right? Like that could be social anxiety, or it could be depression. But if it's specific to looking for somebody who is affirming and somebody who is trained and has a specialty working with that population, and this could also fit for eating disorders, personality disorders, there's a lot of specialty areas. You want to ask those questions, and it is okay to ask, like, what kind of qualifications do they have? Maybe there's a website, again, maybe that person has a website that lists relevant training, relevant information. If you're part of a support group, maybe it's asking, some people. A lot of great therapists are found word of mouth, like, oh, like Holly and I were talking about in the beginning. I might not know, but you know what? I know somebody who might. And, you just kind of
Mm.
start pooling your resources and ask lots of questions would be my best advice to ask before you schedule an appointment.
Yeah, absolutely. And there's also, I know of one in particular, private Facebook group of
Mhm.
parents of youth in the LGBTQ community. And it's a tremendous resource.
Yes.
And it's a safe place
Yes,
to share
exactly.
stories and ask questions. And I'm going to do another little mini commercial. I'm so excited. We have, for our Spanish support group, which meets on Tuesday nights, we're working to bring someone in because the parents wanted to know how to better support when you have a youth who's questioning,
Mhm.
what can you say or not say, or how to support and how to really be educated, because for many people it's a new concept. So
Yes. Yep.
one last question is, do you have any thoughts on how someone could find, I don't know if it would be a therapist or a coach, but like for executive function training?
Yes, there are people who have specific specialty in that. So you could, you could Google it, just social media, but looking for those words. And, if you are calling a therapist and saying, do you do executive functioning coaching? They're going to, yes or no, they're going to know. They're going to say, that's not really my specialty, but, let me try this, or, maybe I can help you find a referral elsewhere. Often that's how we kind of build our referral networks, right? Is that as a clinician, if somebody calls me and I'm like, I know that is not, in my wheelhouse, but let me see if I can find somebody who is. That then helps, over time, you kind of build up a list of like go-to people of who you would refer for those issues. But executive functioning is not something that every therapist would be well versed and trained in. So that would be a question you would want to ask right up front.
Okay, now as a little clarification, I think the parent's interested in being certified. There must be programs
Oh, yes, there
out
are.
there.
Yeah,
And again,
there are.
Googling
I
it,
don't
just
know
Google.
any. Yeah.
And I'm sure this parent must be probably familiar with Attitude Magazine, ADD Magazine. They have so many terrific resources in that
Yeah.
as well, I think.
Yeah.
So
absolutely.
Google's our friend. Is that what you're saying, Jessica?
Google, social media, word of mouth,
Yeah, right.
and make sure that, they have some backing to it. But you
Okay.
could, definitely, research it and ask away, ask questions, call somebody maybe who you see is executive functioning trained, and ask them how they did it,
Mhm.
and see
Mhm.
maybe there's a program out there for you.
Sometimes school counselors, I think, too, have a
Yes.
little insight into that, because obviously it's not a
Very
unique
much.
thing. I mean, it's a lot more common than you realize. So I
Mhm.
applaud your interest in doing that, because talk about something that can make a difference. That's something you can improve.
Huge, yeah.
I mean, that's
Yeah.
definitely something that you can improve. So that's
Yeah.
fabulous. Okay, thanks for the chats, folks. Keep going, Jessica.
All right. So we've kind of been talking a little bit about this, right? So where to find a therapist? Many people start with their insurance company, either making a phone call, going on your directory, and you put in different search criteria. You know, sometimes you just start with your zip code and you kind of go from there. Right now, there's a lot of demand. Unfortunately, many people make many phone calls. And it could be a daunting process. But stick with it, because the right therapist and right clinician, it will happen. But insurance company is one start, because they're listing people who are in their network. Word of mouth, community resources. Sometimes schools have some referrals for common issues, or people, that they've referred to for specific problem areas. Sometimes your employer may have a list of providers. There is social media, of course, internet search. And then these are two others that I definitely recommend. Psychology Today, you can go on there, anybody can go on there, and you could put in all kinds of different search parameters. You're going to most of the time get, a picture of the person, a bio. It will list what insurances they participate in. There'll be some specialties, some training areas. And most of the time you can contact them right from there. You can click, you can send a message, you can make a phone call. And it's a really nice way to, like, you can filter your searches and like really get a feel for who that person is before even making the phone call. So it's a Psychology Today and network therapy are both very similar. So I really recommend, checking that out, because there's a lot of good information in there.
Most of them too, if I can add Psychology Today, most of them will allow a complimentary 30-minute call
Yes. Mm-hmm.
to determine whether or not they're a good fit, but also just whether or not they're equipped, or whether, I've utilized that myself. It's really helpful. Like
Yeah.
you said, the picture helps, Jessica, right? Like
It
you can
does.
see,
It
you can
does. The
just kind
picture
of get a feel
helps.
for the person.
Yeah. So it's also important to remember there are so many different levels of service when we're talking about therapy, from community-based, 12-step, free support groups, up to residential treatment. We've obviously spoke a lot about like the kind of in the middle, the individual, couples, family realm today, but there are many levels of care. So this is very confusing, understandably, for most people. Insurance is confusing. Most insurance plans, Medicaid or traditional, have mental health benefits now. It hasn't always been that way, but most of them do have that. There's language that I wanted to make sure I shared with everybody, because this is whether it's from your specialist to mental health to primary. Not all providers are in network. So in network versus out of network. So an in-network provider is somebody who has filled out an application, has signed on the dotted line and agreed to have a contract with that insurance network, and has agreed to accept their rates for service. So a lot of times that's either in-network or a participating provider. And even if you are seeing somebody in your network, depending on your policy, there may still be a copay, a co-insurance, or a deductible. So in network, there's a set rate that the provider has decided, that they will accept, and that you may still be responsible for a copay. That's not on the provider. That's something that is specific to your policy. Out of network. So an out of network provider does not have a contract with your insurance company. So there is no like regulation on the cost. That provider can charge whatever their rate is. But some providers or some policies do allow out of network benefits. So that might mean that, say, this provider over here is not in network, and you see them out of pocket. You can then, if you have out of network benefits, you can then submit that to your insurance, and you may or may not get some reimbursement back from it. So does anybody have questions about this part? Because I know insurance is tricky. No?
It's like you said, though, it's tricky, but you can navigate it if you're
Yeah.
careful with record keeping.
Yes.
And understanding the policy. And again, it's worth sitting on hold to call and find out how it might work.
And
right?
honestly, even to this day, I recommend making the phone call rather than just looking on your card or looking on the website. And I have a couple questions that you can ask your insurance too, that I'll get to, but I wanted to also cover like self-pay out of pocket. Why on earth would you do that, right?
Mhm.
So Some people do that because the provider they've chosen is not in network with their insurance, but maybe it's somebody who came highly recommended, who really has their specialty. Maybe you have out of network benefits, so you're going to submit it to your insurance and get a reimbursement. Maybe you're paying out of pocket because you're seeing an intern. I have many interns and they do fantastic work. They are being closely supervised. They are in it, like they are learning everything. They are like super, super, super engaged and really doing fantastic work. So that's another reason to pay out of pocket. And typically that's at like a lower cost than if you're seeing a fully licensed provider. And that's the same for associate counselors and social workers before they get the LCSW. Some agencies offer that as an option if an in-network provider is not available. And sometimes the service type is not covered. Certain assessments and evaluations might not be covered by insurance. And then sometimes visitation is not covered by insurance as well, if a family is in an office to see their children. Something always good to ask if you're going out of pocket is, do they have a sliding scale? Sometimes people are hesitant to ask or don't know that that's an option. Some providers it might be and some it might not be. But again, it's a good kind of question to ask up front so that you know what you're getting into.
If you don't ask, the answer is always no, right?
Exactly, right?
And I found also too, sometimes if the patient perhaps is a college student, I mean,
Yes.
they will slide the scale based on the student's income. So that is an excellent point to consider.
Absolutely. And then there's this beautiful site and kind of like little network called the Open Path Collective. And these are providers who, again, a wide range of licensure and education, who have agreed to only charge a certain, no more than, I think last time I really looked at it, I believe it was no more than $50 for a session. And you can click on this link and you can search your providers by area, by specialty. It's really a nice network. And I do believe that to be part of it, there's like a membership fee. I don't think it's that expensive. It is all, in the end, it's definitely lower than some of the out-of-pocket rates. So it's something to look at. It's a great resource to hand out to people who are looking for, therapists and they need a reduced cost. But there's great providers in there. So I want to make sure that I really arm everybody to be able to check their benefits, right? So the first thing to do before you call to ask your insurance company what's covered is really look at your card, have it with you, and also before you call a provider too. And you're going to look for, like, you'll see Aetna just has a member services number. Okay, so that's who you would call. Horizon and a lot of Blue Cross, they actually have something that says behavioral health services. That would be where you're calling to get your mental health benefit information and substance abuse, usually for Horizon or Blue Cross Blue Shield policies. So it's important that you're asking the right questions, even just with your insurance, so that you know what to expect. There's nothing worse than like showing up for something and it's like, oh, you have a $75 copay, and you're like, whoa, like I didn't know that, So this way you can, find out what your policy is, find out what your benefits are, and make sure that you have all of this information ready when you call your therapist, because like we were talking, the demand is so high. So if you have this, like you have your ID number, you have like your billing information, you've already called to see if that provider's in your network, that really moves the process along a lot quicker. Because sometimes there's still verifying benefits and there's things to do before you get in the door. So it kind of helps the process kind of move a little quicker. And when you're calling that number on the back of your card, you want to make sure you're asking about outpatient mental health. And if this is just individual therapy in an office setting, and getting that specific benefit detail so that there are fewer surprises when, claims and things start getting processed. So these are just some questions that you can ask. Some providers will check your benefits for you, but this is always a good thing to do right up front, just to kind of see, do I have a copay? That's a copay is a flat rate. Is there a co-insurance, which means sometimes they will say that they'll cover 80% of the allowed amount. And that means you have to pay 20%, right? So they might not, the insurance probably wouldn't tell you what that 20% is going to be, but your provider will probably have an idea. So co-insurance, copay, and then is there a deductible? And how much of it have you met? Do you have out-of-network benefits? And a big one right now, because this is ever changing, is telehealth covered. Many policies are covering telehealth, even if your initial plan didn't, because of the pandemic. And in addition to that, many have taken it one step further. And if you ask them, is my cost share waived? That means that even if you would normally have a copay, if they say it's waived, then you would not have a copay as long as the state of emergency and the pandemic is happening. So these
And
are
I like,
just some.
what was that term,
good
Jessica? Cost share?
cost share. Yes.
That's important. I had not heard
Yes.
that. Okay.
Yes.
So
Yep. So that covers deductible, co-insurance, copay.
wow.
And always get a reference number. I'm sure we've all dealt with insurance not getting processed the right way at one time or another. But I have found that if you have the reference number, that speeds up the process of getting things adjusted if there's an issue. So I will make sure that this is available to everybody. I know it's a lot of information and questions to ask, but these are all really helpful for when you're getting ready to make an appointment for anything, really. And then we've talked about this, being prepared when you call. What are the presenting challenges? Like, what are those? Is it depression? Is it trauma? Is it grief? What is your availability for appointments? Sometimes that really will determine whether you have to go to a wait list or is there a provider ready for you. So, think about when you might be available. And if this is for a child, many providers will want to make sure that both parents or, guardians consent to the services before getting involved and then having somebody not agree. It's always good to ask the other parent if there's any sort of, divorce or separation. Make sure that it's either documented somewhere or that everybody agrees to it. And again, if you're looking for in-person or telehealth. That's also important to kind of share up front what type of services you're looking for. So let's see, we talked about this. I don't want to rush, through it. I know our lunch is almost over. But really it's okay to ask questions is the most important piece of this, is ask questions, ask for credentials, and see what kind of training people have.
And also don't sugarcoat it, right, Jessica?
Don't
If you're
sugarcoat it. Yeah.
saying I'm worried because my son seems kind of down, that's one
Yeah.
thing. Or to say he's not getting out of bed until 4 o'clock every day, and he's not
Yes,
not
that's a
logging
very,
on to
yeah,
school. So
right.
the more information and the more factual, I know we all like to
Yes.
chat, not
Yes.
lengthy and descriptive, but the more factual, so that these professionals can figure out if they are the best fit, because
Right.
I believe that's the goal. So we're opening it up to
Yeah.
questions in the chat, or you can unmute yourself. Jessica, I can't thank you enough for putting this information together. I can't wait to get the slides in my hands, because there was
Yes.
some lists of information
Yeah,
that
a lot of, yeah.
Jessica did a good job. She does this all the time. So I think there are things that they don't realize that many of us don't know, because it's
Mhm.
not our expertise. So I really appreciate, we're getting some thank yous in the
Oh,
chat, Jessica. I
you're
really
very welcome.
appreciate the basics, but what I'm hearing you say is that we need to ask questions. And let me see, hold on a second there. Question: Would
Mhm.
you expect a provider for a teen to let the parent know if they feel the teen, hold on a second, if they feel the teen is not making progress? That's a good question. Would you expect the provider of a teen to let the parent know if they feel that they're not making progress?
If they truly feel that they are not making progress, yes, I would, because something's stalling that process. But that could also be very, that lens might look very different from the parent thinking the child's not making any progress to what the therapist is seeing, in the session. But yes, I would hope that if there wasn't any progress, that therapist would.
And I've heard these stories where even the parents said, listen, we're still struggling, or I'm still seeing the
Mhm.
behavior and it's not, so sometimes you have to change it up. But I
Yes.
think it's so for every therapist, right? It's different.
Mhm.
And
Yeah.
every therapist's strengths. And
Very much.
I like to believe it's more of a match thing than a good therapist, bad therapist. It's kind of like,
Mhm.
are they what your child needs, or
Sure.
are they what you need? So
Yeah.
you are empowering us to go forth and ask questions, right?
Yeah.
And there's nothing that's off limits. And I think we need
No.
to, you started us talking about stigma. I
Mhm.
think we need to, as caregivers and parents and people living in this environment, we need to know that we have the right to ask questions.
Yeah.
No question is bad. No question
Absolutely.
is stupid, and not to sugarcoat what we're struggling with, because I think we need to really get to the meat of it. So,
Exactly.
in closing, I want to thank everybody for making time for us today. I want to remind you that we will be sending out the recording and notes and these slides. We will be making it available on our YouTube channel. And all you need to do to find our YouTube channel is go to YouTube and Google or put in the search bar Family Partners of Morris and Sussex County. And I'm seeing another question come in here. Let's see. Hold on a second. I want to make sure I get everything in here. Okay, I think they were asking, I see someone say to set the parameters at the beginning of a session, right before a session
Mhm.
starts too, is
Right.
also, is like, if you want a 3 or 4 month review, that was somebody's suggestion.
Yep.
And also, I love this suggestion, keeping a diary
Mhm.
of how you felt, what was going on when you started and where you are. I
Right.
think that's an
Absolutely.
excellent suggestion as well.
Right.
So folks, keep an eye on the things we're offering. Like I said, we have a couple more good sessions coming up on parenting a child during trauma, on supporting youth who are sexually questioning, or members of the LGBTQ plus community. And I want to thank everybody for coming out and making us a part of your day. Jessica,
Yeah. Thank you so
fantastic
much.
job. Thank you very
Jessica,
much.
I have a question. I'm sorry,
Yeah.
because I was waiting for you to get done, Holly.
Sure.
Okay.
Does certain trainings require you to have a certain degree before attaining them? Because some of the trainings you can do without a degree,
Right.
or the other trainings that you have to have your bachelor's, for example, before attaining
Mhm.
another training before going about it.
Right. And they are all different. The answer is really, it depends. It depends on the training. It depends on the certification. But that's a really good point to make sure you're looking at that before, if you yourself are looking into a certification or something like that. It's always good to kind of check that first, but they're all very different.
And I like that people are asking about trainings, because Jessica, I see this as a field that's going to grow, because I
Yeah,
think,
absolutely.
thankfully, our awareness of things like executive functions has grown
Yes.
tremendously.
Yes.
And also, I think the recognition that mental health is a part of our general health. And I think
It
with
is.
the pandemic, I think we're only going to
Mhm.
begin. Jessica said earlier that a lot of times it's teachers or guidance
Mhm.
counselors or
Yes.
coaches or choir directors who might notice when our children are behaving differently or concerning. And I think a lot of people have been very preoccupied with
Yeah.
getting food on the table and keeping everybody safe, that some of those things might have gone unnoticed. So I applaud our participants who are looking into,
That's
finding out
excellent.
different ways to be helpers. So everybody stay healthy, and we hope to see you again next week.
Yes.
We are actually, how could I forget? Next week, we're talking about support groups. And you might say, Holly, I know what support groups are. Well, I'm here to tell you, you have no idea how many are out there, how many are available. They're free, and you have so many choices. And now, instead of driving somewhere, you can sit in your jammies with your cup of tea and log on. And not only that, you can log on and in different groups, but there are also some groups that are going to join us that have things where you type in anonymously questions, conversations. There are so many different choices, and we are really eager to share those resources with you. And speaking of which, we're also going to share resources with you about some free counseling programs that are available, and low cost programs that we're aware of that you might not be aware of. So look for information to follow. And Jessica, thank you for your time.
Oh, thank you so much.
Okay, everybody, be well.
All right. Bye.
Bye.